Okay, I want to know if everybody can hear me. Let me turn up my own volume so I can hear others. Do share. Okay, good. Right there.
Karen's in there. Hi, Karen. It's Ariana.
Oh, here we go. Okay. So I'm going to go ahead and start. Thank you. It looks like people can hear me. So our journal article that we're going to look at today is called Early Hormonal Treatment Affects Body Composition and Body Shape in Young Transgender Adults. So why did I choose this article? This topic is a topic I wanted to know more about because hormonal treatments, taking hormones, impacts the body and development globally. And knowledge about the impact of these treatments can contribute to the practices of speech language pathologists, occupational therapists, and physical therapists, and the education we have to offer patients and the questions we may ask trans patients in a medical setting. So I want to understand hormonal treatments better as a speech language pathologist, especially because they have a powerful role in the sound of a person's voice. And of course, as a speech therapist, I'm very interested in the voice, and because hormones can impact the voice, I want to know more about them. So many transgender patients, especially trans women, so birth assigned boys, have difficulty with the impact of hormones on their voice. And we can educate patients on some of the science and refer trans people with voice dysphoria for voice therapy. I know there's some background noise here. Is this okay? I'm wondering if people can hear me okay with the background noise. Maybe I should go in a room. I don't know. Yeah, maybe I'll just go in here. Okay. Here. Okay.
Oh yeah, that's true.
Okay. 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 Forgive me real quick. Give me 1 minute. I'm just going to, thank you. Switch rooms just because we have somebody treating a patient out here in the cancer center. Here, I'll just sit here. I'll take it. Okay, thank you. Okay. So many transgender patients. Oh, I already read this one, so I'm going to go to the next slide. So I also wanted a study on hormones because I wanted to know and understand hormones better. And I wanted a study that had more of an objective and measured approach to emphasize more of the physical rather than the psychological impact of hormones on the body. Because a lot of the studies that I looked at were more interested in sort of the psychological impact when it came to a person's voice. And I wanted a study that was going to look at some more objective data on the body and it's what happens to the body with hormones. So I want to go over some definition of terms. These are terms that were frequently used in the article. The first term is a suffix, the suffix cis. This this suffix cis comes from Latin and it means on this side. It does come from the same Latin root as we get the word in English, this. So this and cis are coming from the same Latin root. I tried to think of any other Latin languages where a word uses this that may mean on this side. And the only thing I could think of was in Spanish, the word cerca, which means near. I don't know if that comes from the same origin, but it could. So if we use the term cis man, what that means is someone who was assigned male at birth and identifies as a man. So it's somebody who was born as a male and continues to identify as a man into adulthood. So then a cis woman is someone who was assigned female at birth and identifies as a woman. So cis meaning this, coming from the same side, the person has not switched sides, as opposed to the word trans. Trans also comes from Latin and it means across or beyond, so as to change. And this is a suffix we're much more familiar with in English because a lot of our words do use trans, like transportation, transport, etc. So a trans man is someone who was assigned female at birth, but who lives and identifies as a man. So they have switched from the female assigned role at birth to now a man. A trans woman is someone who is assigned male at birth, but who lives and identifies as a female. There was one more term used frequently in the article, and it was the term affirmed sex, or I've also seen online the term affirmed gender. And this is a term used to describe a person's gender based on their innate understanding of themselves. So what was the aim of the study? The aim of the study was to examine the change in body shape and composition from the start of treatment with gonadotropin-releasing hormone analogs, and then followed by cross-sex hormonal therapies until 22 years of age to compare these measurements in the body at 22 years to those of age-matched peers or cis persons. So I want to say a little bit about the hormone they were given at the start of therapy, because this was, I think, what I want us to understand more about or know more about when we're working with patients who may have had some sort of hormone therapy. So the hormone they were initially given is called gonadotropin-releasing hormone analog. This is a drug. It's a synthetic peptide drug that's modeled based on human hypothalamic gonadotropin-releasing hormone, and it's designed to act on the anterior pituitary. You also see the word analog in the title there, and analog is a substance with similar characteristics to another substance, which without being identical to it can fulfill some of its functions. So this basically is a drug that mimics a hormone in our body. There's two kinds of analogs. There's agonists, which are drugs that bind to the receptor, producing similar responses to the intended chemical and receptor. And then there's antagonists, or drugs that bind to the receptor either on the primary site or another site, which altogether stop the receptor from producing a response. These patients in this study were also given cross-sex hormonal treatment, and this can mean different things based on what gender they were transitioning to. So for a trans man, a birth-assigned female, they were given exogenous testosterone to induce virilization and suppress feminizing characteristics. And then trans women, or birth-assigned males, were given exogenous estrogen to help feminize the patients, and anti-androgens are used as adjuncts to help suppress masculinizing features. This was a retrospective study, so all the data that they got was taken from a review of medical records of all adolescents diagnosed with gender dysphoria at VU Medical University Center from 1998 until December of 2015. And this university medical center was in the Netherlands. So the patient problem was, how does body shape and composition develop using gonadotropin-releasing hormone analog and hormonal treatment? And do transgender persons obtain the desired body phenotype using these hormones? So the intervention, gonadotropin-releasing hormone analog treatment, was started, and cross-sex hormonal treatment was added at 16 years of age for 71 trans women, so birth-assigned boys, and 121 trans men, birth-assigned girls, who started treatment from 1998 to 2024. Anthropometric and whole-body dual energy X-ray abscitometry data were retrieved from medical records, and a linear mixed model regression was performed to examine changes over time. You can kind of see here on the right, this is from the article. They initially started with 489 patients, but then they had to exclude patients for different reasons. Sometimes the patients were on a different protocol, so they weren't able to be included, a different hormone protocol. And then they had 225 patients who hadn't reached yet the age of 22 at the time that they closed the study. So comparison and intervention. Standard deviation scores were calculated to compare body shape and composition with those of age-matched peers. So what they measured was a change in waist to hip ratio. They measured total body fat, and they also measured total lean body mass during hormonal treatment. And standard deviation scores of measures of body shape and composition were compared with age-matched peers or cis persons at 22 years of age. When they say that they compared these people to age-matched peers, they didn't just select a random group of cis persons. What they did is they went to something called the Tanner stages, which is something I had not heard of before the study. But apparently in the 1940s and the 1960s in England, they measured the external genitalia of males and females, and this is what they used. I think they also must have used the other things we're looking at the study, like body fat, waist to hip ratio, and they used the numbers they had from these Tanner stages to compare with the transgender people who took the hormone therapies. So here's the outcome of what they found. In trans women, birth-assigned males, total body fat increased with these hormones, while total lean body mass and waist to hip ratio decreased. So when they compared trans women to cis women, they found that the waist to hip ratio was somewhat equal, and also that the total body fat was very equal with cis women at the same age. When they compared trans women to cis men, they found that the trans women had a lower waist to hip ratio and a greater total body fat. So the trans women looked very similar to cis women in their body shape by these measures. And then when they looked at trans men, they found on the contrary that total body fat decreased while lean body mass and waist to hip ratio increased. So when they compared the trans men to cis women, they found that the trans men had a larger waist to hip ratio and less total body fat. But when they compared them with cis men, they had lower waist to hip ratio and a greater amount of total body fat compared with cis men. So I want to go over some of these little graphs that look at what they were measuring. In this first graph, we're just looking at body fat. If you look at the lowest line on the graph, the soft gray dotted line, that's cis men. So men that were assigned male at birth and continue to identify as men. So we can see that cis men have the lowest body fat of any of the other groups. After them, at age 22, the next group that comes closest are trans men. So these birth-assigned females who took hormones and are now trans men did have a lower body fat, but it wasn't the same as cis men. And then you can see that trans women and cis women are almost identical at 22 years of age as far as how much body fat they have. So this next graph looks at lean body mass. So again, if we look at the very bottom of the graph at the dark gray dotted line, that's cis women. So cis women had a lower amount of lean body mass. And then we can see on the opposite side are cis men who had the most lean body mass. And then in the middle are trans women and trans men, with trans women being closer to cis women and trans men being closer to cis men. So, and then the last thing they looked at was waist to hip ratio. And this was actually a little counterintuitive for me. I thought that females would have a larger waist to hip ratio, but the way this ratio works is that females would tend to have a lower waist to hip ratio. So if you look at this graph, we see cis women have the lowest waist to hip ratio. And after them were trans women. Then we see trans men, and at the very top with the highest waist to hip ratio, we see cis men. So how does this topic relate to our patients? This comment here is from the researchers, said that this was their comment on how this topic relates to patients. They said, knowing body shape and composition outcomes at 22 years of age will help care providers in counseling transgender youth on expectations of attaining the desired body phenotype. And then I added kind of 2 additional points of how I think this topic relates to our patient. I think understanding the hormones, or maybe getting a little glimpse into them, helps us understand some of the science involved with hormone therapies for people wishing to be, who have been, or who are in a gender transition. And since there are physical implications and our therapies are physical in nature, it helps us know how to proceed with our treatments. And we can ask LGBTQ population, if we get anybody like this in our our office or that we're treating anyone like this, we can ask them if they've had any hormone therapies, what therapies they may have had, and when they started their therapies to better understand what norms we should use in evaluation and how to best help our patients with our therapies when we're making a therapy plan. So main objectives learned. During treatments, waist to hip ratio and body composition changed toward the affirmed sex. At 22 years of age, trans women, birth-assigned boys, compared better to age-matched cis women than to cis men, whereas trans men were between reference values for cis women and cis men. So what evidence-based practice from this study can we share? I think the evidence from this study shows what we can expect with someone taking a hormone therapy consistently at 22 years of age, and specifically these hormones that were looked at in these studies. So at 22 years of age, trans women compared better to age-matched cis women than cis men. However, trans men were between reference values for cis women and cis men. So what are the strengths and limitations of the study? The strength was that this study presented with the largest group of transgender adults at the time of its publication in 2019 who started treatment in their teens. This study provides insight into the effects of gonadotropin-releasing hormone analog and cross-sex hormonal therapies on body shape and body composition during treatment in adolescents to give transgendered adolescents starting treatment better information on the extent to which their bodies will change and what results to expect. As far as limitations, only one hormone protocol was investigated. So from this particular study, we can just know about this particular hormone protocol. And then there was some variation with the time at which the hormone therapies were started. So on the right, I took a little clip from some of the research from the article. And it says kind of close to the top, I think it's the second line, the age that they started the gonadotropin releasing hormone analog. It sometimes varied up to 2 years at the age of the time that they started this. So that seems like a pretty big range for an adolescent, 2 years. So I do feel like that was a limitation for this study. There was also, in the data they looked at, there was missing data, which occurs frequently in studies with a retrospective design when data are collected during regular patient care. And then change in body fat and lean body mass are dependent on other factors, such as a person's diet and their physical activity, and those were not systematically recorded. So we can't know with the results that maybe diet of certain persons or physical activity may have contributed to their body fat, or maybe they had less body fat because of diet and physical activity. Also, the participants were primarily white. I said this was conducted in the Netherlands. There were some other people in the study that were not white, but it was primarily white. And there were also less trans women that they had data on than trans men. Also, I feel like a limitation of this study, it told us what the values were at 22 years of age, but we don't know what happened and what the data would have looked like if we'd measured these people later on in their life. At 30, would they still, would these values be consistent? Outcomes and practice changes. We can ask patients if they've had hormone therapies and have a general idea of the effects. And hormone therapies cause significant physical changes, leading to more significant alterations during puberty more quickly than cis persons. So I think this is something that these graphs on the right really show, is that we do a lot of changing in adolescence, but for a person taking hormone therapies, they're doing a lot more changing, a lot more rapidly because of the hormones that they're taking. So I would think this could have a psychological impact on a patient as well, to experience so many physical changes so quickly. Hormonal changes are still being studied. However, a general idea of results from this study can be known. So here are my references. And then that's pretty much it. Does anybody have any thoughts or questions?
I guess I have a thought, Marilyn.
Uh-huh.
I really liked how I really enjoyed the limitations of the study in terms of pointing out sort of they're primarily Caucasian, and also
Right.
the fact that they did not measure diet
Right.
in its impact on sort of hormonal
Right.
sort of impacts. I thought those were things that I didn't consider, and I like that the study pointed them out because I know that they can absolutely have an impact on
Okay.
sex hormones based on sort of body fat percentage and that sort of thing. So I appreciated those limitations that were pointed out.
Okay. Thank you. I have a thought too, and that is when they did this study, I think they started with like 400 something people that they were looking at, and only one person left was not able to participate in treatment because they stopped taking hormonal therapy. But I wonder what the statistics are for how many people start taking a hormonal therapy in adolescence and maybe then change their mind or stop taking hormonal therapy for some reason, and what impact does that have on a person's body? I think that's another question I would have, just kind of as I've looked at hormones in this study. If anybody else, I'm going to leave some time just for anybody else to ask questions or maybe make comments.
Yeah. Very interesting topic. I think from a physical therapy standpoint that when I've seen transgender patients, not only does it impact their body composition, but by nature, body composition impacts joint mobility. Joint mobility is something we're very interested in, at least from a physical therapy standpoint, at least the big joints. I did note that the hips were a bit more stiff on this young,
Right.
basically trans man.
Uh-huh.
They did not feel like the hips of someone born female. And
Oh,
I
wow.
thought that was interesting. I didn't have their baseline
Right.
measurements of like, how did they feel before they transitioned?
Right.
But I definitely think that this has implications in ways that
Right.
maybe we're not fully considering and are interesting at the very least.
Right. I think kind of looking at the bones and the health of joints, like you said, from taking these replacement therapies, I think that would be something interesting if there was any data or information on that. That's really interesting, your case study. And I feel like I've read somewhere about the bones being something happening with them with the hormone therapies, like the health of the bones, but something I don't know about yet.
Another thing that my patient mentioned was that when they were transitioning male, it was like going through female menopause. And I am interested in the long-term effects of going through a female menopause so early in life. Does the body kind of sort it out? Do they have some of the side effects of long-term menopause later in life?
Right.
These are things that I would love to see research done on, and maybe treatments as well.
Yeah, I think I would love, like, I like your thoughts. And I think if anybody listening has like some additional thoughts or things that they're curious about, feel free to email me. I'm kind of thinking of maybe trying to do like a larger looking at beyond this article, but maybe doing something for our departments on transgender persons and hormone therapies. I feel like it's a very interesting topic that it would be good for us to have some knowledge and background on when the patients come into our office. So I'm kind of thinking I might try something larger. So if anybody has any specific questions, and maybe you think of it later, you could definitely email me. And then we do have a couple more minutes. So I think I'm just going to also see if anybody else has any more questions, but feel free to email me if you have some thoughts of things you're curious about or would like to know more about for this population. And then I want to say one more thing, I think, about gonadotropin releasing hormone analog. My understanding is that this particular therapy is suppressing the expression of hormones that are released during puberty. So it's kind of delaying the onset of puberty in some ways. And I believe the same hormone has been used for females who have precocious puberty, where they start puberty at a very young age. Sometimes they'll give them, I think, the same drug to prevent them from going through puberty that early, so that the girls can grow a little bit more before they enter puberty, and it won't affect their height overall.
I have a question.
Yeah.
So I'm interested in see if you can find like research like comparing that these transgender patients who gone through this hormone therapy while like puberty or like during puberty compared to like when they started hormone therapy when they're just like gone through puberty already. What's the difference on their like body composition change and all those things, all these things?
Mm-hmm. So you're saying, like, if we look at people going through a transition and we look at what were their measurements beforehand, their personal measurements versus their measurements afterward, how far off was that from?
Yeah, I just
like,
want to see that what are the benefits of going through then like earlier?
Oh, yes. Yeah, no, I think that's a really good question. How would we see better, maybe
We see like better like
better results had they
results,
started their therapies at like 13 rather than 15. I would think that could be a big difference. So I agree, that would be a really interesting study to look at. If people are given these hormones much earlier, do we then see that their phenotype is matching their affirmed gender much more? I think that's a really good question.
That's what I want to see if
right.
yeah.
Right. That would be good to know, because then if you do get somebody who's starting a hormone therapy at 16, it would be nice to have data to say, what, you may not get, maybe look exactly like a man or look exactly like a woman because you're starting the therapy later. But right now, I don't know that we have. I don't have the data to say that to a person, although I would suspect that it's true. So it'd be nice to have some studies that show something about that.
So in my experience, my patient that I saw was in their mid-20s and started transitioning in their early 20s. And
Okay.
their endocrinologist told them to not expect a lot of physical changes.
Okay.
And they were surprised at how many physical changes that they did experience, and were very pleased.
Oh, wow.
And so there may be a little bit of variation person to person as well, based on that very small trial size.
Yeah. Right. Yeah, all really good questions. I think too, kind of the interaction of diet on hormones, like you were saying, Alicia, and exercise on hormones and development, like those weren't taken into consideration. So that would also be, I think, some interesting information. But I think that's all for today. I'll maybe give it a couple more seconds, and if there's no questions, we'll go ahead and sign out. And I think next month in May, do we know who's presenting?
I don't remember, either Karen or Bernice.
Okay.
Yeah, I'm going to be presenting in May. I have an article. I'll send it out sometime this week. The lady, it has to do with stroke patients and NIH stroke scale and prognostic indicators. So.
Very good.
Great, thank you. And then I'm taking June, I believe, Alicia.
Okay, sounds good. I'm going to go ahead and
I have it written down, just not in front of me.
I'm going to go ahead and end the meeting. Thanks everyone for attending. Like I said, if you have some thoughts about maybe something you'd like to hear more about, like Ingrid mentioned something, and then Alicia had some comments, but any other thoughts you have, and maybe you'd want to hear more about this topic, if you message me, I can kind of see I might do a larger presentation on this topic. Thanks everyone for coming, and have a great Wednesday.
Thank you, Marilyn.
You're welcome. Record and transcribe. Good. There we go. Stop recording. Yes, please stop.